These videos are made for the members and students at the Sports Therapy Organisation. Okay, so let's talk about the hip joint. The hip joint is an amazing ball and socket joint, and it's a really good circumductor, so it moves in lots of different directions. So it's excellent at rotating inwards and outwards. It's also, of course, a key flexor and extensor. So the main movement it does is flexion and extension, which is designed to, it's designed obviously for walking. So the hip is very mobile. It's not as mobile as the shoulder, but it's a mobile joint, and it's also stable. It's got a good rim around the socket, which we call labrum, and this is the femur. This is the pelvis, we do see quite a few different problems with the hip joint. I think the most common hip joint problem that we see is osteoarthritis, and osteoarthritis is obviously a degenerative condition where you lose the hyaline cartilage on the ball of the ball and socket joint, so you get degenerative changes, osteophytes, sclerosis around the joint, which stiffens up the hip joint. So the hip joint is an amazing joint, and we do sometimes see issues with it, and it typically gives you pain into the groin. It can spread pain around the outside of the gluteal area as well. What I'm going to do is show you how to examine it at the hip joint. And first thing we'd do is we'd take a history. So I want to know about where the hip pain was, how long it had been there for, what were the aggravating and relieving factors, what tends to make it hurt. Really, where's the pain? What seems to make it worse? What makes it better? And this is just a very quick video, of course, so I'm going to rush through this a little bit. Then next thing we'll probably do is a hip joint examination. The key movements we really want to know is, how does it flex and how does it rotate. So usually if you just lie on your back for me, and I'll just bend the hip into flexion. So I want to see how much movement we've got there. Is it stiff? Now a stiff hip will usually sort of stay around 90 to 100 degrees of hip flexion, and so that we know would be a stiff hip. This is a standard hip movement into flexion here. We can also check rotation, so we can check internal rotation and external rotation. Good. We can check abduction as well, and we can check adduction. Oops. There we go. Good. If we wanted to check extension, we can lie our patient on the side and just extend the hip. Now, in terms of hip treatment, one of the key things we might do is we might just mobilise the hip joint, so we can hold the hip like so, and we can just mobilise it. It's a really nice way to passively move the hip joint and encourage blood flow to the area. We can also just push into flexion, so we can just hold here and work the hip into flexion to get some movement. We can do some soft tissue massage around the anterior hip. So the rectus femoris, the hip flexor, comes up to here. It does run deep, but we can massage into the top of our quadriceps. And we can do some stretches to the hip, like a glute stretch, for example, where we can just take the knee sort of more towards the opposite shoulder and just hold the stretch. And where do you feel that, Lucy? Yeah, right in the glute. So that's a good glute stretch there. We can do an adductor stretch if adduction is limited. So we can just stretch the adductors. So just a few techniques that we can do. Now, again, when we prescribe exercises, we really want to prescribe exercises based on what we find. So if we find the hip is hypermobile, we'll probably advise to do some stability exercises. For example, we might just lift the leg to here for me, just hold that position. That's a great stability exercise. Or just lie on your side for me, please, Lucy. We could do a clam, for example, just lift that up there. Good, hold that there. These are stabilisation exercises. They're very, very light. They're very straightforward. They do no harm exercises. They just start to build some gentle strength around the hip, around the glute. So they're really, really nice exercises to do. Straighten the leg, hold that there. Good. So again, this is a stabilisation exercise, so it helps improve the stability of the muscles around the hip joint. If you want to make that into a strengthening exercise or resistance, we can use a resistance band, or we can add an ankle weight to this, or we can make the exercise more dynamic. We can start to look at squats and lunges and multi-directional lunges and hops and things like that. But for this we're just going to stay straightforward. And we can do some hip stretches as well, so have a lie on your back for me please, Lucy. So let's imagine that the hips are quite stiff. If we just get Lucy to do a hip stretch, we might just get her to stretch the hip herself. Now, there's nothing wrong with static stretching. It's very, very, very useful tool. It does improve mobility, absolutely. You know, you need to do this repeatedly to get the effect, but it's still a really, really, really useful tool. We can bring that more into a glute stretch, like so. So Lucy can do this on her own when she's not having the treatment with myself. So that's an example of some of the things that we can do with the hip joint, and I hope you find that useful. So I'm on rehabmypatient.com here. I've put my patient details in. Here's Lucy, student, and there are her back exercises on the previous video. Let's just make a new exercise plan for her. Let's just go to the hip joint. So I can go to hip here, and we talked about a flexion stretch. So let's just go and find a single leg flexion stretch. So here's a double leg flexion stretch, but let's find a single leg flexion stretch. So now the key thing is, once you find the exercise you like, make sure you favourite it, because then you can here's a good one. So there's a flexion stretch. I'm going to favourite the exercise and add that. We also talked about some stability exercises for the hip. So if you want to find stability exercises, you can just go down to the stability area. You know, here's some good stability exercises here. You can go to strengthening as well, and here's some stability exercises. So let's give it the sideline leg lift, and let's give the clam. Now, if you want to make that stronger, we can of course put a band in as well. That's a really nice exercise. But let's keep it simple. 3 straightforward exercises. Let's put hip exercises as a plan name. Press continue. We're going to hold the stretch for 30 seconds and repeat 3 times. And we're going to repeat 20 reps twice a day and 25 clams twice a day. And we're going to email that, and we're going to print that for Lucy. And there's our exercise plan sent to Lucy. So I've done an examination on my patient, Lucy, on my client. We've done some treatment on Lucy, and then we prescribed an exercise plan. There's your exercise plan. I always print out the exercise plans because it's something that then clients or patients can take away with them. It's like an added extra for your treatment. Very, very useful, and it really helps with adherence to doing the exercises. So that concludes it, and I'm going to move on to the next video now for you.